how these muscles contract by the help of this calcium, and what changes occurs in these zones and bands, right? We will discuss this in a quick review. For example, I have, this is for example the Z line, right? And Z line is attached to myosin actin proteins, right? And these actin have sites for myosin heads, right? And we have one thick protein called myosin, and this is now an inactivated form, right? Because a protein called tropomyosin blocking these all the sites, right? We have this troponin, this is troponin, right? For example, this is ATP, myosin head, and now ATP binds to these heads, right? ATP mean adenosine triphosphate, mean having three phosphates, right? The first step here is the hydrolysis of ATP, the hydrolysis of ATP. So the first step is hydrolysis of ATP. What it means that ATP break down into ADP plus inorganic phosphate. What is the mechanism behind this hydrolysis? This whole mechanism. This is responsible for the hydrolysis of ATP into ADP and phosphate. Now, when it become hydrolyzed, it become like this. For example, I have, this is Z line, and these are the actin proteins, and these are the sites, right? That mechanism is done. These sites are now open for binding of these myosin heads, right? Because calcium is present. Now, what will happen that this ADP will bind to one part of this head and phosphate will to another, right? And it will bring some conformational changes, right? What that conformational change is, it will bend, right, and will attach to the actin sites, right? For example, if you people remember, I have told you that when ATP hydrolyze, the head become like this. It brings some conformational change. That conformational changes occurs here. Now what happened? What really happened? That for example, this is A, B, C, three sides. Side A, side B, side C, and we have three heads. 1, 2, 3, right? This is the head A, head B, and head C, right? What will happen that this, if this A head is attached to this A side, it cannot contract, right? It must well go and will bind to here. For example, A will bind to B, and B will bind to C, and this C will bind to D, and D will bind to E, right? And so on. for example like this. But now phosphate and ADP are attached to these heads. This is called the attachment of the heads and two actin sites, right? The next thing is the dispatch or detaching of phosphate group. For example, if this is the head, and now it have ATP only. When it hydrolyze this ATP, it will bind to this site. Now when the phosphate group will leave this head, it will contract, right? For example, these all are attached to this. For that we will take another Z line. For example, this is the Z line and this one is the Z line, right? It have actin and it also have actin, and this is the myosin, right? Now this step is called the dispatch of phosphate, inorganic phosphate, and when it dispatches, the heads will become like this. For example, this is the head, and when phosphate leaves this head, it become like this, right? And when it bends, it will contract the muscle, right? This is called the power stroke. This phenomenon is called the power stroke because now the myosin heads are using its power, right? So for example, all these heads become like this. For example, this is the myosin head, and after hydrolysis of ATP, it is binding here like this, right? And when phosphate is detached, it become bends, right? And when it bends, the actin contracts, right? What will happen to these bends? For example, this is the Z line and this is also the Z line, right? When these myosin heads contracts, it will contract all these myosin to its direction. And which direction? These head will contract the myosin in this direction, and it will contract the myosin in this opposite directions from each sides. For example, this is actin and this is actin, and when the myosin heads bends, it will contract the myosin. So the Z lines will come close to each other, right? In muscles contraction, the first step is Z line close to each other, right? Z line, this Z line and this Z line, because these actin proteins are attached to this Z line by nibulin proteins. Do you remember nibulin proteins? So all the Z line, for example, this is Z line and this is Z line, and when the actins are contracted, it will bring close to each other, right? So by this is the A band. For example, these are the myosins, right? This red area, this whole red area is A band, right? This A band become less in size, right? Because for example, this is the actin, the actins are contracting, the A band will contracts. Am I right? No, why? These myosins are in its places. A band will remain same. A band will not affected in contraction, right? Because this is the A band. This is the A band. For example, this one is the A band. So from each side it will contract, but the A band will remain same the a band چې دا په خپل ځای ول دا ریډ چې تاسو ښکاري دا خو چینج پدې کې نه راځي کنه صرف د دې د هډ شي نو دا کنټریکټ شي ٹھیک ده نو z lines are come close to each other a band will not affected but the edge zone will disappear the edge zone will disappear because for example this is for example this middle of fingers this is the edge zone and when actins are contracted the edge zone will disappear it will go into each other right so the next thing is here z line will come close to each other number 2 a band remain same 3 what happens to I band contracted so I band will contract and it will become less right it will become small right so for example and next step I band contracts mean become small or less the next thing is edge zone what happens to edge zone it will disappear and most of your papers in your MCQs this question is present what happens to edge zone in muscles contraction the 4 options are remain same contract increases disappear right so this is the muscles contraction by calcium and this is the whole neuromuscular junction پوه شوي زه شکر دی تاسو پوهیږئ نور به ګورو ښه ته چا چې څه کوېسچن په نیوروماسکولر جنکشنز کې